Let me welcome all my viewers once again today on Beyond Sugar. It's always a pleasure connecting with you on these live programs. As you are aware, Beyond Sugar is created for all of you, where not only we post information for all of you on a daily basis, but also to interact with you, we invite leading doctors from across the country who can talk to you directly and answer your queries as well as a friend. So please be candid in asking whatever queries you have in mind. I'm very glad to welcome today Dr. Vinice from the city of Chandigarh. Sir, welcome to the program.
Thank you.
So we keep on getting a lot of questions and chats from our viewers who follow us, and they want to understand a little more about the complications of diabetes, especially kidneys, and how to protect kidneys during the diabetes state. And today we will be taking questions in this regard. But before taking in the questions from our audiences, for all of you, let me formally introduce Dr. Vinay Sakuja to all of you. He's one of the leading and most senior nephrologists in our country and based at Mohali, which is near Chandigarh. He has been serving in PGI Chandigarh for close to 4 decades before he joined Max Hospital after his superannuation. And it's such a proud thing to share. He joined that prestigious institution as a medical student and then superannuated and worked as a dean and officiating director as well. In 20 years of his tenure as HOD nephrology, not only he has treated lakhs of patients there, but also trained dozens of young nephrologists who are serving today across the country and treating patients. With more than 300 publications in various national and international journals, he also has 50 chapters in the textbooks and many prestigious awards to his credit. In a nutshell, I can simply say that he is an institution in himself, and it's an honor today for all of us, including our viewers, to hear him directly. Let me, sir, straight away get you here and hand over to you for your opening comments and setting the context on this topic, and then we will take in the questions.
Uh, Thank you very much, Mr. Mehra, for your kind introductory remarks. It's a pleasure to be on this platform today, on which I am appearing for the first time. It's a new experience for me, but one that I would be looking forward to both today and in future. And today we'll be focusing on the kidney in people who have type 2 diabetes mellitus and what we can do to protect them from damage, and what we can do if they are already damaged, then what we can do to slow down the progression of disease. So all the things that we need to do to protect the kidneys in diabetes, that is going to be our focus this evening.
Yeah. Thank you, sir, for setting the ball rolling and joining us today. Let's start by asking you, and a lot of our people, viewers, want to know that is there a real connection between the diabetes and kidney disease? How serious is that, and how uncontrolled blood sugars can have an impact on individuals' kidneys? If you can start by explaining this to us, I think it will be easier for us to understand and move forward.
Sure. So, kidney disease is a complication that develops something like 8 to 10 years after the onset of diabetes mellitus. And it doesn't happen in every diabetic, it happens in about 30 to 40% of all type 2 diabetics. One of the important risk factors certainly is the blood sugar levels and how good their control has been during that period before the development of kidney damage. Uh, there are, of course, other risk factors as well. The duration of diabetes, as I've already mentioned, is one important risk factor. So, kidney damage doesn't occur in the first few years of diabetes. Hypertension is certainly another important risk factor. A history of smoking increases the chances of developing kidney disease, and a family history of kidney disease due to diabetes also increases the risk. Coming back to the blood sugars, the target of HbA1c that we recommend for all diabetics to achieve is an HbA1c of around 7.0. In young diabetes with recent onset young diabetics with recent onset diabetes, one may try to target a lower hemoglobin A1c of around 6.5. But one has to remember that the lower your HbA1c target, the higher the risk of hypoglycemic episodes. So one has to always be careful about this. And coming to the blood glucose targets that we want to achieve, so the fasting blood glucose targets that we need to achieve are between 90 and 130 milligrams per deciliter, whereas the random sugar levels, that means the post meal levels, can be anywhere up to 180 milligrams per deciliter. So, in the 24 hours of daytime, the sugar levels should not go below 90 and should not go above 180. That would be the ideal level of control that we would like to achieve in order to reduce the risk of developing kidney involvement.
Thank you, Dr. Sakuja, for giving it in such specifics and making our viewers aware. One thing he very clearly mentions that if someone is having diabetes, so there are 30 to 40%, people who may have kidney disease as well over a period of 8 to 10 years. And then there is a strong correlation between how well your blood sugar levels are managed, and if they are managed well, the risk will be lower. And if they are not managed well, between that 90 to 180 range, which he has shared, then the impact will be higher. So I think this is very, very important for all of us to understand. So now, most of the times, the approach while a patient is meeting a physician for diabetes, they generally, talk about that what is the blood sugar level, and it's most of the discussion happens around that. How would a patient know that there is a kidney disease which is setting in or his organs are getting affected? For a common man to understand, are there any early signs and symptoms which you can help us know, which someone should be looking out for? And if he sees those signs and symptoms, it's time for him to talk to his doctor.
Yes. First and foremost, every patient should know about the various organ specific complications that he can develop as a result of diabetes. So, knowing that the kidneys can get involved is being forewarned. Now, one of the early features which indicates involvement of the kidneys is, which the patient may notice himself, is a frothy urine. So, what we call froth-uria. And this is because of loss of albumin in the urine. This is, in fact, the earliest feature of kidney involvement. And sometimes the loss of albumin in the urine can be of very large proportions. And as a result of that loss, the patient may develop swelling on the feet and sometimes on the face around the eyes. And this is because of the loss of albumin, the blood level of albumin also decreases, and that leads to this edema or swelling. The other change that might be noticed is a rise in the blood pressure of these patients, and much later, of course, the blood levels of serum creatinine might also begin to rise. So this is the usual sequence of events as far as early kidney damage is concerned.
Okay. So look out for these symptoms if you have diabetes and the duration has more than 5 years, probably look out for these symptoms which is shared. And if there are such symptoms, talk to your doctor. Sir, are there any screening tools as well, or do you recommend that if someone is having diabetes, he should do screening to detect kidney disease earlier? So if yes, then what should be the frequency of that screening, or what kind of tests patients can get done?
Yes, yes, certainly. Uh, Screening for kidney disease should, in type 2 diabetics, be done right at the time when diabetes is first detected. This is because there's often a delay in the detection of diabetes in these patients, because in the early stages, a mildly elevated blood sugar doesn't cause any symptoms at all. And so it may go undetected for even a couple of years or even longer than that. So, and in fact, if you screen patients at the time when diabetes is just being detected, you'll find that maybe 20 or 25% will already have some evidence of kidney involvement. So, therefore, screening for kidney involvement should be done right at the first time the disease is diagnosed. Now, what kind of screening should one do? A routine urine examination should be the first step. After that, one should do an albumin creatinine ratio in the urine. This should preferably be done on a morning sample of the urine, because that is the most concentrated urine sample. But it can also be done on a spot urine sample at any time of the day. And this test should be repeated. uh, if it is negative, it should be repeated at least once in 3 to 6 months. The other investigations that are worthwhile doing is to get a baseline serum creatinine estimation and to get an ultrasound of the abdomen to look at the kidneys to make sure that there is no other pre existing abnormality in the kidneys. So, that is the baseline investigation that I would advise.
Okay. So many of our viewers, you may not do get these investigations done on your own, but you will surely be, meeting your diabetologist or physician if you're having diabetes. And many times they will recommend these investigations. So never deny them or ignore them. It will be very, very important for you to get your kidneys checked early and detect if any problem is arising. Sir, in your earlier comments, you also talked about the role of blood pressure on the kidney health. So now, in a specific situation where a person is having diabetes and is having some kidney issues as well, so does blood pressure also play a role in contributing or deteriorating the situation? And are there any numbers like you gave for blood sugar? So are there any specific numbers for blood pressure also, which patients should be aware of to keep themselves fine?
Yes, control of the blood pressure is very important at all stages of diabetes to slow down the involvement of the kidneys, to slow down the progression of kidney disease. It is, if it is already there, there's no doubt about that. uh, and the blood pressure target that one would like to achieve would be a level of around 130 by 80. So that would be a reasonable target for all patients. Uncontrolled blood pressure, besides harming the kidneys, can also harm the heart, the brain, and the eyes. So, all these target organs can be protected if we control blood pressure at the appropriate time and to the appropriate level.
Okay. So with this, I think we have largely understood from Dr. Sakuja today that what is the correlation between diabetes and blood pressure with the kidney disease, how we can detect it early, what can be the early signs and symptoms. So now, sir, let's move on to what can be done in this regard. Now, if someone is having diabetes or such risk factors toward kidney disease, so the first thing is the person himself has to take some measures, or in the early stage of the disease. So, any advice you give to patients, what changes they should make to protect their kidneys, particularly with respect to their lifestyle or nutrition things.
Yes. I'll take up the nutritional component first. So, all patients who develop diabetes first need to be educated about the ideal diet that they should be taking, what is forbidden for them and what is allowed to them. So, all forms of sugar and sweets are forbidden. Uh, Patients should be told that they are not allowed even good or shakkar, because they often under the misconception that that these contain less sugar, and so they are okay as compared to refined sugar, but that is not so. They also need to be told that fruit juice and cold drinks are all to be avoided, and certain fruits like mangoes, bananas, lychees, and so on, those which are very sweet, uh, should also be avoided largely. Whereas other fruits like apple, papaya, guavas, pears, etc., those can be permitted to these patients. In place of sugar, these patients can be allowed to take sugar substitutes. Some of the sugar substitutes that are now available, like stevia and Splenda, aspartame, these can be taken in place of sugar and can be added to tea or coffee or milk, or you can even prepare a dessert with any of these sugar substitutes. So, the first thing is this part as far as the diet is concerned. Yes, consuming too much of potatoes, which are rich in carbohydrates, or taking rice very frequently should also be avoided. So that's as far as the diet is concerned. The next thing is many diabetics are obese. So it would be ideal if these patients could lose weight and come down to their ideal weight. I know that this is not so easy, but definitely it is an aim worth trying to achieve at least. And this aim is to be achieved by a combination of dietary restriction of all sweets and fried foods, and physical activity. And of course, patients can choose whatever physical activity they find suitable, and depending on the weather. So, whether it is brisk walking for an elderly person, or for a younger person, it could even be cycling or swimming or playing a game of badminton. So, some form of physical activity and dietary restrictions. So, these are the two main things which can help achieve at least a moderate degree of weight reduction. Of course, in those who have morbid obesity, then one has to consider different options like either bariatric surgery or certain new drugs like semaglutide, which have now become available and which can help achieve a significant amount of weight loss. Another thing with regard to lifestyle that is very important is stopping smoking altogether, because smoking and diabetes is a very deadly combination for the development of atherosclerotic disease, vascular disease in these patients. They already have diabetes, so if they are smokers, that's another very serious risk factor, and they need to stop smoking completely. And finally, with regard to alcohol, both alcohol intake in excess and diabetes contribute to the development of a fatty liver, and so alcohol intake should be significantly reduced, if not, if it can't be totally eliminated. So it's a lesser evil than smoking, but definitely in excess would be harmful to these patients. So I think these are the lifestyle changes that are worthwhile in these patients.
And so there's a lot also talked about the protein intake. There are various myths related to it that it has some positive or negative impact on kidney. What's the expert's view? Would you like to guide us on the protein intake?
Yes, yes, yes. That's another important question. Now, in the early stages of kidney involvement, as I already mentioned, there may be albumin urea, and during that stage, the albumin levels may drop below normal, and that may be a cause of edema. So, at that stage, these patients require an increased protein intake. However, when the serum creatinine goes up, that at that time the advice is different, uh, unless the albumin levels are low even at that time. If the albumin levels continue to be low at that time, they still need a high protein intake. But in those in whom the albumin levels are normal, then the protein intake should be restricted, and they should be allowed up to zero point 0.8 grams per kilogram body weight per day of protein. And it's not only the quantity of protein, it's also the type of protein that is important. So, restricting their vegetarian protein intake is not really required, but intake of non vegetarian items should be restricted, and in particular, that of red meat, because that contributes to metabolic acidosis once the serum creatinine has risen. So, that should be avoided or taken only infrequently.
Okay. So, to all my viewers, I think these are some very, very important aspects which Dr. Sakuja has just explained us in last 5 minutes with related relation to nutrition and the lifestyle measures. And this is all in your control. You don't need to go to someone else to get these things done. You can change your lifestyle. You can manage your nutrition as well. In case you missed any of these things or forgot, just rewind back this program. It's going to stay here and hear him again. Very, very important aspects for you. So
Yeah,
now,
just one small point I'd like to add.
yeah,
See, earlier, uh, the protein intake that was recommended for patients with an elevated serum creatinine was zero point 0.6 grams per kilogram. That means lower than the current recommendation. And this message seems to have gone down to virtually all physicians and dietitians across the board. And many times now, by the time a patient reaches us, he has already been advised by mostly by dietitians to totally stop protein intake. And that is what I'd like to warn against. Uh, so, the current recommendations do not warrant such severe protein restriction? I'm pointing this out because many patients who come to us tell me that I'm just eating lauki and tori and vegetables, and I've been stopped from eating all dals. So I think that advice is wrong. It's an extreme opinion which I don't agree with. So, reducing protein intake to that level is not at all required.
All right. So again, very very specific things from an expert on this, and a message for dietitians and nutritionists as well. So let's now come on to the treatment approaches. Now, the patient has reached you, and then under your supervision. So what are the and now someone a diabetic person has got a kidney damage. So what are the various treatment approaches which you adopt to keep this patient healthy? And while you elaborate this, please also, if you can specifically help us understand the importance of dialysis as well as the transplant and when they are recommended.
Yes, I'll come to that also. Okay. Uh, During the early stages of kidney involvement, when there is albuminuria, uh, we generally put these patients on drugs which are called inhibitors of the renin angiotensin system. So one of the most common drugs that we use is telmisartan, which is an angiotensin receptor blocker, and this drug helps in reducing the albuminuria, and it also helps to some extent in controlling the blood pressure if it is already high. Of course, while we are using these drugs, we need to keep monitoring the potassium levels because with the use of these drugs, the potassium levels can sometimes go up. And if that happens, one may need certain additional measures to bring down the potassium levels, and one may even need to stop these drugs at least temporarily. So this is the first thing that we would like to use. If with the drugs like telmisartan in a suitable dose, the blood pressure is not adequately controlled, then we would like to add other antihypertensive drugs like calcium channel blockers or alpha blockers or centrally acting drugs, and we can even combine these to control blood pressure adequately. And we also ask the patient to reduce his salt intake to around 5 grams a day to help in control of blood pressure. The next thing is to look at lipid levels in these patients. And if the LDL cholesterol levels are high, we would like to start a class of drugs called statins. So we generally use atorvastatin in a dose of about 10 milligrams a day. And our aim is to reduce the LDL cholesterol levels to less than 70 milligrams per deciliter. The next thing is to use diuretics, uh, that is, drugs which increase the urine output. So we generally will give these patients torsemide, particularly if there is swelling of the face or feet, or if the potassium levels go up. Uh, Anemia also develops as kidney damage progresses, and this may require the administration of iron, folic acid, and vitamin B12. And if that is not sufficient, then the administration of erythropoietin. These patients also need sodium bicarbonate tablets, particularly if their bicarbonate level is less than 22. So we like to maintain the bicarbonate levels between 22 and 28 milliequivalents per liter. And finally, these patients should be vaccinated for certain infections uh, to which they are very prone as the disease progresses. So, vaccinations for influenza, for pneumonia, for hepatitis B, and herpes zoster should be given to all these patients.
Okay.
Yes, coming, you had also asked about
Yes.
dialysis
So
and transplantation.
correct. So, and in the same breath, sir, there is a question as well to one of
Yes.
our viewers have put is that is Mr. Bhanu Pratap asking that his PUV surgery was done in '98 and a BNI surgery in 2013, and he is a CKD stage 4 with the creatinine levels 3.3. So, anything you like to comment on his state as of now, or what kind of advice he may need?
Yeah, so he's not mentioned whether he's diabetic or not. So I presume that is not his problem. So the other things that I have mentioned, as far as management is concerned, would apply to him also. The only point that may not apply is the use of telmisartan or the use of RAS inhibitors. Control of hypertension would be the same if he has hypertension also. The use of soda bicarbonate, the treatment of anemia, the use of diuretics, that will all be the same for this patient as well. I would treat with statins only if he is more than 50 years of age. I'm not aware of his age. He hasn't told us about that.
Okay. So I think these are some of the basic advices, Mr. Bhanu Pratap, what Dr. Sakuja can give you. However, looking at your situation, you should immediately, meet your nephrologist. I'm sure you would already be in touch and take specific advice based on your overall condition. Sir, we were coming on to the next question that, when would these patients would require dialysis or they are recommended kidney transplant by you? And how does that, impact the longevity of life or the quality of life for the patients?
Yes, yes. So when the serum creatinine level rises to around 7.5 or 8 milligrams per deciliter, and that is a stage when there may be loss of appetite and vomiting as well. There may be an increased amount of swelling on the feet or the face. There may be a decreased urine output. There may be shortness of breath as well. So, this is the situation when the patient needs to be started on dialysis. Both the kinds of dialysis that are available, that is hemodialysis and peritoneal dialysis, both are suitable for these patients. Both can be considered depending on the patient's choice. Uh, Obviously, if a patient is going to go for hemodialysis, he also needs a vascular access procedure in the form of an arteriovenous fistula, which is a kind of vascular surgical procedure which needs to be carried out when the creatinine reaches around 6 milligram per deciliter. Now, this is something that is not done by a nephrologist, it is done by a vascular surgeon. So, you need to go to a specialized surgeon for this. And after the fistula has been created, it takes a period of at least 6 to 8 weeks before it will be usable, because it takes that much time for the fistula to mature. And that is why we don't want to wait until the creatinine is 8 or 9. We want to do it when the creatinine is just around 6 milligrams per deciliter, so that the fistula is ready in time when the patient requires hemodialysis. Kidney transplant can certainly be a very good option for those patients who are under the age of 70 years and who have no major cardiac problems. And it definitely gives an even better quality of life as compared to any other form of dialysis. in diabetics. Sorry. So, kidney transplant is certainly a good option for those who don't have any heart problems, and can be considered even for diabetics, just as in non diabetics.
Yeah. So no, thank you very much, Dr. Sakuja. And I know that some of these topics around dialysis and kidney transplant itself can be a big discussion, and many of our viewers would like to know about that. But we'll invite you again, for those. But today, for the awareness of all our viewers, I think these are some well-known ways of treating the kidney disease, which Dr. Sabuja has shared with us, and they can surely, provide a far better quality of life and longevity to the patients as well. So, since we are also running out of time, so I'll just take, quickly last two questions, and if you can help us so that diabetic people who have diabetes, they have a lot of other comorbid situations as well, which can be cardiovascular issue. They may have issues related to their eyes and multiple other things. So does those things also have some major impact on the kidney health, and how that can be taken care of?
Yes. So, diabetics, diabetes is a disease which affects virtually every organ in the body. There's hardly anything that gets spared by the ravages of diabetes, by the complications. So, we've largely talked about the kidney today, but um atherosclerotic vascular disease is one of the major complications of long-standing diabetes, and this disease can affect the heart. So you can get coronary artery disease as a result. It can affect the brain, and as a result of that you can get a stroke. And it can also affect the circulation of the lower limbs in the form of peripheral vascular disease. So patients can develop gangrene or foot ulcers as a result of that. In addition, the uh, microvascular disease in diabetes can affect the peripheral nerves, as a result of which they can get sensory loss, vibration loss, and symptoms like burning of the feet or pain in the feet and the legs. And finally, the retina can be the target of damage and can lead to loss of vision or impairment of vision. And involvement of the retina, in fact, goes hand in hand with involvement of the kidneys. So, all of these need to be looked after when you're seeing a patient with diabetes and kidney disease. It's not just the kidney disease that the physician should be targeting or looking at.
Yeah. No, thank you for giving this whole comprehensive view again, and how they are connected with the kidney health as well. I think, sir, I must thank you for covering this whole subject from end to end and making us more aware about it. But many of our viewers, before we conclude, would also like to know from you that are there any very recent advancements which have happened, or anything which is on the anvil as a new science which is coming, which can help them protect one of these vital organs, kidney.
Yes, I think one thing that I'd like to emphasize is that as kidney damage progresses, the blood sugar levels tend to go down in many of these patients. And in fact, uh, the development of hypoglycemia as kidney disease develops is in fact often a warning that kidney disease is actually developing. The patient may have not detected it, may have not got investigations done, but the development of a spontaneous episode of hypoglycemia, despite the patient having taken being taking the same oral hypoglycemic agents. So this is an often a warning feature that means that kidney involvement is occurring. So, this is something that patients need to be aware of, and therefore they may need to reduce the type of oral hypoglycemic agent they are taking or the insulin that they are taking. And the other thing that I'd like to um make patients aware about is that in the recent years, there have been some new developments as far as the oral hypoglycemic agents are concerned. So, we have a new class of drugs called SGLT2 inhibitors, or also called glyphosins, a name which is easier to remember. And these have been shown to help in the control of diabetes, at the same time protecting the kidneys from further damage, and also protecting the from the cardiac complications of diabetes. So these are new drugs that are worth using in patients who already have kidney involvement or who are just beginning to have kidney involvement. And then there is another new drug called finerenone, which is an aldosterone antagonist, and this can also be added to the drugs that these patients are already on to provide further protection. And finally, there is very recent data which shows that the GLP-1 receptor agonists, namely semaglutide, can also be used to further improve glucose control and protect the kidneys in these patients, and also to help in treatment of obesity in the same group of patients. So these are new developments that have come about just in the last few years.
Okay. All right. So I think here we hear from Dr. Sakuja what is the latest also in the field of managing the kidney disease, which gives us an assurance and some confidence to all our viewers that even if they pick up the kidney disease, I think there are enough measures with the nephrologist today to provide you a good, long, healthy, and good quality of life. So, but it will be important to understand this whole paradigm which he has shared right from the point one of early detection, picking up the signs and symptoms early, and also moving on how you need to be taking care of your lifestyle, nutrition, and then of course your doctors will be there with the treatment approaches to help you also. But a lot of role would be played by the patient himself if you are more aware and taking the timely actions. Sir, I must thank you. Today you came over today, took out your time, and in such a simple language. I know it's a complex topic, but you have simplified it for your viewers so much that I'm sure that this is going to help thousands of people understand that what is the connection between diabetes and kidney disease, and how they should be taking care of that, and when they should be reaching their doctors for the timely advice. But before I conclude this whole program and thank my audiences, let me give it back to you in case you want to summarize, or if you still want to highlight anything important which we have missed out still.
No, all I'd like to say, I think I've made myself clear. I've expressed my views in detail about this subject. But I think the most important thing is that patients generally reach their nephrologist very late in the course of the disease. So they need to be proactive and go to the nephrologist as early as possible. And if they are being looked after by an endocrinologist, then yes, they should ask him the relevant questions to make sure that early kidney damage is being detected well in time. And in case there is kidney damage, then go to a nephrologist also as early as possible. So that's the parting message that I would like to leave behind.
Yeah. And I think that's a very important message. which Dr. Sakuja is leaving us with. Detect early and reach your doctor timely, nephrologist especially. And if you do that, then you can save your kidneys in a better way. So, with this, not only I thank Dr. Sakuja today for joining us, but I thank all my viewers and audiences who joined us live today during this program and who would be listening to this program later on as well. I'm sure that today's discussion with Dr. Sakuja has helped you understand this whole subject well, and you will be able to manage yourself well. If you have any friends or family members in your circle who have diabetes and who are at risk of picking up kidney disease as well, you can simply share the link of this program with them, and this conversation can be very, very useful for them. If you live anywhere in North India and you have these symptoms which Dr. Sakuja shared, you can always visit Dr. Vinay Sakuja at Max Hospital in Mohali. If you are listening to us anywhere far away in some other city, please don't ignore his advice still and meet your nearest nephrologist at the earliest possible. So, with this, I thank all my viewers, and Dr. Sakuja, thank you so very much for joining us live today. It was really a pleasure to have you.
Thank you very much for the opportunity.
Good night,
Thank you.
everyone. Bye bye.